Chapter 13, Lower Gastrointestinal System. Slides 32 through 118 are for your reviewing pleasure. Just kidding. Seriously, you need to review it all. Enteritis, inflammation of the intestine, primarily the small intestine. When stomach is also involved, it is called gastroenteritis. Chronic inflammation may cause the lumen of the intestine to become thickened, irregular, and narrowed. This looks like thickening of mucosal folds and poor definition of circular folds. Use a small bowel series or enterocolitis to examine this pathology. Regional enteritis, segmental enteritis, or Crohn's disease, inflammation of known origin involving any part of the GI tract, but usually the terminal ileum. Segments of the lumen narrowed and irregular, gives you a cobblestone or a string sign, which is the sign which is common. Again, a small bowel series and enterocolitis. Giardiasis, common infection in the lumen of the small intestine caused by Giardia lamblia, usually affects duodenum and jejunum with spasms, irritability, and increased secretions. It looks like dilation of intestine with thickening of circular folds. Small bowel series and enterocolitis are your exams. Ileus of the small intestine, obstruction of the small intestine. Adynamic or paralytic is cessation of peristalsis. Mechanical obstruction is physical blockage of the intestine. The radiographic appearance is abnormal gas patterns, dilated loops of bowel, circular staircase look, or a herringbone pattern. You're going to do an acute abdomen series, small bowel series, and enterocolitis. Meckel diverticulum. Common birth defect caused by the persistence of the yolk sac or umbilical vesicle results in a sac-like outpouching of the intestinal wall, found in about 3% of adults. No symptoms unless inflamed. Radiographic appearance is a large diverticulum of ileum proximal to the ileocecal valve, rarely seen on barium studies. In order to evaluate this pathology, a nuclear med scan, small bowel series, and enterocolitis is going to be your best way of seeing it. It did say it's rarely seen on barium studies, so I'm not sure if the small bowel series is very effective. Neoplasms, new growth, benign or cancerous in the small intestine. Benign tumors include adenomas, leiomyomas, mostly found in jejunum and ileum. Carcinoid tumors, most common tumor, lymphoma or adenocarcinoma. And you have lymphoma seen on small bowel series as a stacked coin appearance due to the thickening, coarsening of the possible hemorrhage of the mucosal wall. Adenocarcinoma is mostly located in the duodenum or proximal jejunum, seen as short and sharp napkin ring defects within the lumen, which may result in obstruction. Blockage may be seen on small bowel series. Enterocolitis can also be used. Size and location of the tumor may be seen on a CT of an abdomen. Sprue and malabsorption syndromes. The GI tract is unable to process and absorb certain nutrients, typically certain proteins and dietary fats. May be due to an intraluminal defect, a mucosal abnormality, or a lymphatic obstruction. Can be due to lactose and sucrose sensitivities. Small bowel series, mucosa may appear thickened as a result of constant irritation. You also have celiac disease, affects proximal small bowel, proximal duodenum, and commonly involves gluten. Whipple disease is a rare disorder of small intestine. The cause is unknown. It's a dilation of the intestine, edema, malabsorption, deposits of fat in the bowel wall, and mesenteric nodules. Radiographic appearance is a dilation and distorted loops of small bowel. You're going to perform a small bowel series to evaluate this disease. Colitis, inflammatory condition of the large intestine. Intestinal mucosa may appear rigid and thick and lack haustral markings along the involved bowel segment. The radiographic appearance is a thickening of the mucosal wall with loss of haustral markings. You're going to do a barium enema. You can do a single contrast, but a double contrast is preferred. Ulcerative colitis. Chronic condition, most lead to development of coin-like ulcers within the mucosal wall. Common form of inflammatory bowel disease. Radiographic appearance is a cobblestone and possible stovepipe appearance with severe cases. You're going to do a barium enema, single contrast, but a double contrast is preferred. Diverticulum, outpouching in the mucosal wall, common in adults older than 40 years of age. Diverticulosis is multiple diverticula present. Diverticulitis is the inflammation of the diverticula. You're going to have barium-filled circular defects projecting outward from the colon wall, jagged or sawtooth appearance of mucosa. You're going to do a double contrast barium enema. Intussusception, telescoping or invagination of one part of the intestine into another. Most common in infants but can occur in adults. Barium enema can be therapeutic for this condition. It's going to have a mushroom-shaped dilation at distal aspect of the intussusception with very little barium or gas passing beyond it. Single contrast or an air-gas contrast enema will be performed. Neoplasms, new growths, mostly cancerous, common in large intestine, most common in rectum and sigmoid colon. Annular carcinoma, also an adenocarcinoma, typical form of colon cancer, frequently results in obstruction as tumor grows and infiltrates the bowel wall. Radiographic appearance is the filling defects, narrowness or tapering of lumen, an apple core or napkin ring look of the lesions. Radiographic exams include a double contrast enema, small lesions, CT, or colonography. Polyps, sac-like projections project inward into the lumen, not outward like diverticula, can become inflamed and bleed. Radiographic appearance is a barium-filled sac-like projections projecting inward into the lumen of the bowel. Double contrast barium enema, CT, and clonography is your choice of radiographic exams. Volvulus. Twisting of a portion of the intestine on its own mesentery results in a mechanical obstruction. Blood supply is limited, resulting in death of tissue. Tapered or corkscrew appearance with air fluid distended region of intestine. Single contrast barium enema is your exam of choice.